Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Hung Ecklund. She's joining us here as Medical Director of OBGYN at ModMed to discuss the need to automate OBGYN care processes. Her specialty deals with a high-touch patient population combined with a physician population that's estimated to shrink by about 50% by the year 2050. And automation can help offset the growing workload that's placed on physicians. Welcome to Health Professional Radio, Dr. Ecklund. Thank you so much for taking the time.
Hi, Neil. Thank you so much for having me. So a little bit about my background. I graduated from medical school in 2002, and the OBGYN specialty really drew me in because it gave me the privilege to be part of one of the most tender, special moments in a patient's life. You know, and after 20 years of doing this, the relationship I have with my patients, the journey I have walked with them, well, that is what is so fulfilling. In recent years, though, I noticed a great challenge in our field of OB/GYN, the administrative burden that is consuming our time. It takes us away from our patients and forces us to look at a computer screen. So when I was asked to be medical director for OB/GYN at ModMed, I realized that this was my opportunity to take action and be part of the solution. So ModMed is a company that was established in 2010. It has designed award-winning specialty-specific software, and it's done a remarkable job in the 9 specialties that currently exist. Derm, ortho, to name a few, and now OBGYN is coming.
You spoke of administrative challenges in the field. What are some of the other challenges in the field of OBGYN that you've noticed in recent years?
Well, I think one of the biggest challenges is right now we're facing a shortage of physicians responsible for providing care to women who represent half of the population in the U.S. This gap between the supply of OBGYNs and the women who need them, well, they'll get even bigger over the next decade unless we find a way to retain more OBGYNs for longer in the workforce. You know, our specialty, it's really physically demanding. We have unpredictable and long hours, including overnight call. And no question about it, there's been stress brought on by the pandemic. So OBs are choosing to retire early or to reduce their workload by giving up the obstetrics portion or working part-time. And this leaves a heavier burden on the remaining doctors in the workforce. And so, as I said before, physician burnout, one of the biggest contributors to that is the administrative tasks and the clerical work that we do. And this is in addition to caring for our patients. So my mission at ModMed is to address this challenge by making software that is more physician-friendly.
So what do you see as the role of tech being in addressing some of these challenges?
Anything doctors do over and over again. So from basic tests we order during the course of pregnancy, basic counseling that we engage in different stages of a woman's life, such as menopause. Well, these things, they should be simplified so that doctors can focus on their patients instead of the computer. But the thing is, we don't want to add automation by sacrificing the art of medicine in the process. So there's the nuance, in how each doctor delivers care. A patient might be coming in to, for their 36-week pregnancy visit. And, we have our routine things we do. We check on how they're doing. We check this lab called GBS and, we have our routine. But what if her blood pressure suddenly rises and we need to deal with, this issue that has now become complicated? Well, the system needs to be able to be ready to deal with those more complicated things and not take an excessive amount of time. It needs to be efficient. So we need a system that remembers how each individual doctor likes to do things and capture it in the course of her workday. And it shouldn't be something that needs extra admin time where you have to set up templates, counseling. It should be a system that adapts to the needs of the doctor.
With so many of those subtle nuances to be considered, do you think that OBGYN as a specialty overall has taken advantage of technological advances thus far?
Well, I think a huge part of adopting technology is that it first has to be available because I think if it exists, yes, OBGYNs would adopt it. The problem is that for a long time, women's health has been overlooked and underfunded in the tech space. However, early this year, I attended a conference that focused on femtech, and one of the speakers from McKinsey and Company presented their research analyzing 763 tech companies focusing on women's health. And the data is really promising and shows a significant rise of interest and funding in this space. I think the phrase she used was that women's health tech is on the cusp of disruption. And for me, this is exciting that attention is finally being turned to women's health and efforts are being made to deliver better care. So we at ModMed want to be part of being able to provide better support for doctors and practices, which in turn will allow us to provide better care to our patients.
Well, what would you say are the tasks in the office specifically that have the most potential for the automation that you're speaking of to lend that support to doctors?
Yeah, so there are tasks that we do over and over and needs to be streamlined and efficient. So reminding patients for appointments, like coming to their annual well woman exam, pap smears, mammograms, things where we need to inform them of normal results. When we have certain order sets that we typically want to evaluate particular problems. We want to communicate instructions to the patients, like for, pre-op, post-op visits and things like, patients filling out forms or getting their insurance information. It really should be seamless.
Do you see opportunities for improved patient engagement for pregnant patients?
Yeah, the thing is that, I was just looking at some data the other day, and that the Pew Research Center said 97% of the U.S. owns a cell phone and over 85% owns a smartphone. So Americans are more likely to use their smartphone to manage their day-to-day lives. And this can include healthcare if the right technology exists. So, what do I see? You can engage with patients with educational material. We can have them really be well aware of their care plans and reminders. All of these would be really helpful, especially if it's delivered in a way that the patient finds intuitive and easy to use.
Now, obviously, telehealth was emerging before the pandemic, but once the pandemic happened, it just exploded. It seems to be a permanent fixture in many areas of healthcare. What's your view on telehealth and OBGYN? Do you think that it's a permanent fixture in your specialty as well?
Oh, yeah, I think it definitely has. The pandemic has transformed the role of telehealth in the field of OBGYN. At the time, we needed to keep women safe, and early on, it was important to find a way to be able to provide this care outside of the office. And the thing is, pregnancy visits, well, it couldn't be postponed like elective surgeries. Babies were coming, the moms needed care. And it wasn't just maternal care. We had to provide fertility care, menopausal care, gynecologic consultations. And so telehealth really helped to fill that gap. For many things, of course, we still need to see the patients in the office. Someone comes in with a pelvic mass, with pelvic pain. We need to see that. There's no getting around that. But things like consultations for infertility, menopause, contraception, many of these can be via telehealth, and it's really convenient for the patient. So yes, I think telehealth is here to stay, and that is a good thing.
Looking toward the future, what do you see the role of tech being in OBGYN, 5-10 years from now?
So I definitely think it can improve the delivery of care to patients. So that earlier I talked about, educating and engaging a patient so that they're able to participate in their own care. I think it can be very valuable in providing support for physicians, not just in, documenting and those types of things, but also to provide excellent care because they have easy access to guidance from our most respected medical societies. It can be very convenient for patients. So if we make it just work in a setting like a smartphone app, these are modalities that are really familiar, comfortable with patients. And I would say more so in the future, well, we want to make it accessible in that way. I know it can help us in our improving diagnosis, improving clinical outcomes. One of the examples is artificial intelligence, AI technology that's shown to improve IVF success rates. The other thing I can see is, there are things that have been somewhat neglected, right? So perhaps we are able to now shift focus to these areas like menopause, sexual health, pelvic care. Those are things that hopefully we see tech playing more of a role of in the future. And then finally, I just want to bring it back to the challenge I spoke about earlier. It's really timely, actually, because last month, the U.S. Surgeon General, Dr. Vivek Murthy, issued an advisory sounding the alarm on healthcare worker burnout. And Dr. Murthy said, the nation's health depends on the well-being of our health workforce. Confronting the long-standing drivers of burnout among our health workers must be a top national priority. We owe them a debt of gratitude and action. And that's what we want to do at ModMed. We want to take action and build something for OBGYNs, a specialty that I know from experience really needs and deserves this.
Well, give us a website, if you would, where our listeners can learn more.
Sure. Yeah. So you can find all the information at www.modmed.com.
Doctor, it's been a pleasure speaking with you. Thank you so much for your time this morning.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Hung Ecklund. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.